last month I did a previous talk on detox, and I have lots of talks on that. So if you want to look at my other videos, you can learn a little bit more about that. Common causes too is just not exercising or moving enough. So sitting too much. We are just rusting out. We're not wearing out, or we're inflaming out, because when you're not moving, you're not pushing the fluid around in your body, and that leads to more inflammation in your body, accumulation of things. So when we move, that's how our body gets some of the circulation to our body, and we need to move. So just low level of activity will also make you inflamed. So again, back to lifestyle. So the lack of exercise we just talked about. Chronic stress. So how does chronic stress affect you? Well, we produce hormones that tend to be caustic to our body and cause us to be more inflamed. So if you're stressed, that's going to cause those hormones to flow, and that's going to cause your body to just build up that fluid as well. Obesity. So again, eating too much, not having that good exchange of calories and accumulation of calories. You put weight on, that's going to cause more pressure on your body, your spine. That's going to contribute to inflammation. Too much unhealthy microbes in your gut. So unhealthy microbes, we're talking about like yeast or candida, bad bacteria that accumulate. Some people maybe have like H. pylori that causes stomach acid. There's a lot of bacteria that accumulate and cause inflammation that are not good for us. And I'm not talking about eliminating all bacteria. What we want is bacteria in a healthy balance. So we might need a little bit of that H. pylori to help process certain things. But when it gets an overgrowth because we're feeding it too much sugar, or we're feeding the yeast too much sugar, that's going to cause inflammation throughout our body. So too few healthy microbes. So that's all the probiotics. I'm sure you've heard about probiotics. It's a very hot topic the last 2 decades of the good bacteria that help us be healthier. They produce vitamins and nutrients that we actually need, and they're helpful to us. And so those probiotics are really good for us to be in there. And sometimes we have too much of the bad and not enough of the good, and they're out of balance, and that just causes an overall inflammation. Most of the time in the gut. It also can be inflammation in our arteries, which could lead to heart disease, that building up the plaque. A lot of times it's not the cholesterol that's the problem when you build up in our arteries. It's inflammation from all these unhealthy things were going on. So poor sleep. So I just actually attended a thing last night, and somebody was talking about work-life balance, and she said the number one thing is the most important is sleep. We try to shortchange sleep. In our society, we're deficient of sleep about 2 hours on average a night, and you can't get that back. And so that's important back to our brain about healthy hormones being produced. And if you're not doing enough sleep, you're going to be prone to being more inflamed and producing those caustic hormones. So we talked about the toxins, so just your everyday life, but how about the ones that, I have tobacco use, which is usually nicotine use, because we have so many different forms now. It's not just chewing and smoking anymore. We have vaping, we have the nicotine pouches, we have the nicotine patches, we have the nicotine gum, we have all kinds of ways we like to pollute ourselves these days. So nicotine in general is obviously not healthy, and even though you're not maybe smoking it, that still is a contribute some kind of ill health. If it's not going to affect, heart, like lung cancer, not contribute maybe to that lung cancer, but maybe mouth cancer, or somewhere else that nicotine is going to reside in your body and cause problems. And then drinking too much alcohol. Alcohol is a sugar. Sugar is inflammatory. So alcohol also gets in the brain. It's not good for the brain. And it causes inflammation in the brain. That's why we have that nasty hangover the next day when you drink too much. So that's one of the reasons why. So common causes, or common symptoms of inflammation. So pain, like the typical, like I said, you sprain that ankle, it's painful, that joint swells up, it's fluid. Now, the thing about the inflammation, it's a positive thing. Like the body does it on purpose. The body needs inflammation. So we don't want to eliminate the system completely, because when you're inflamed, we tend to, the body sends all the good guys to help repair. It means damage. It's signaling there's damage done to that tissue, and the body wants to put the good guys into reinforcements, send them out, send the materials they need to rebuild and fix that material, fix the ligaments, fix the joint, go in there. So it's important, and also signals pain doesn't mean bad things. It means you need to stop. You don't need to damage the joint anymore. The body's trying to tell you something. So that's important for like acute sprains, strains. But, muscle aches also could be a good thing, as in it's telling you need to limit yourself, you're damaging tissue, or is it telling you you're not moving enough? So you have to find that balance of what's going on. And so fatigue is another thing. We have a lot of chronic pain in our society. We're going to get a little bit more into that. So also brain fog, mental issues, that can cause inflammation from the brain. We're going to talk about what things can help with that. It can cause mood disorders. It can cause GI stuff like I was talking about, diarrhea, reflux, ulcers. You can have IBS symptoms. All those things could be just an inflammatory in the internal. So also not on here is also your skin, like eczema and psoriasis, and those things also can be a sign from possibly causes from inflammation. So, also some people think about, obviously we talked about obesity, but if you're underweight, sometimes that's because your body's overcompensating in other ways. So there's a term called skinny fat. And so you might be skinny, but you're inflamed. Like I have some people that are like actually overworking out and they're hurting themselves to that detriment, and they're inflamed because they're doing it too much. So as we age, also our muscles might not need as much resistance. Maybe we need to maintain resistance. So lately I've had a lot of my baby boomers that have been working out, been working out their whole lives. They're trying to exhibit the wellness lifestyle, wanted to, stay healthy. And now they're starting to be like, I can't lift the same amount of weight that I used to do. And I'm like, yeah, that's okay. We'll back it down. Keep doing what, do the weights, but we need to back it down because your body's starting to age, and you don't have as much muscle as you did before. And that's just part of the aging process. Unfortunately, there is no fountain of youth. I joke around with that. It's like, we do want quality of life here in the office as best as possible, but unfortunately we all have a time limit that we're going to age out. So I'm going to try to give you the best way to do that as gracefully as possible, but there's points where we need to listen to our bodies, and sometimes we do need to just back down, continue to work those muscles, but not to the point where we're starting to hurt those muscles. So, because the body, if it starts to inflame, it's because it's telling you that in some ways. So, other things, the infections, reoccurring infections. So I have people with like the recurring yeast infections, reoccurring, like they said, that Lyme's disease is a hard one sometimes to nail down. We have other things, infections. I've heard a lot of times of Epstein-Barr, or if you've had mono when you were a kid, that kind of reoccurs and it causes inflammation in you. So a lot of these other viruses that we've had, they can kind of re-erupt, because most people think you have a virus and you get over the symptoms and you're fine. And that's actually not what actually happens. What happens is your body gets it under control, and it's still in your body a little bit, but it's just the body's maintain it. So just like your brain, we get data every day and we collect that. We collect memories and we collect the information. Well, the immune system has a memory too. And it's also doing this whole collection of keeping viruses at bay. So it's integrated into us. So if that integration, it gets out of control due to stress, due to improper lifestyle, whatever you're doing, it can come back and flare back up. So example, we have chickenpox as a kid. Later in life, usually if you have a stressful moment in your 50s, all of a sudden we get shingles, which is the same as the chickenpox virus. It just expresses itself in a different way. So what we want to make sure is we keep that immune system healthy to suppress some of these things to help your body stay healthy. So headaches are common, brain fog, like I said, mental strains, so the skin rashes, lymph nodes. It's one thing we didn't talk about. So if you've got just chronic inflammation of your lymph nodes, that's maybe part of your lymph system is not clearing enough. And that's kind of where the inflammation travels through our body. So we want to make sure that we're just taking care of our lymph system too. And that's water, making sure we're drinking enough water. I personally, this last year, got a rebounder last Christmas, And I've been rebounding, which is really good for getting the circulation going in the lymph system. If you don't know what rebounding is, it's that little mini trampoline, and I just have a little exercise routine. I just bounce on my trampoline, and it's actually kind of fun. It made my exercise a little bit more fun, but that helps get circulation through my lymph node and get some of this fluid moving around. And I feel it. It's funny because this time of year right now, we have like a lot of allergy season and stuff like that. And I literally can feel my ears kind of drain through that. So it's kind of cool how you can just do naturally little tiny things for yourself to help with that. So the medical way of dealing with inflammation is the drug approach. So usually commonly with NSAIDs, non-steroidal anti-inflammatories. So that's your ibuprofen, or the name brands ones are like Motrin, Aleve. You also have your naproxen, which is the Aleve. So those are things that work. They shut down the signals for inflammation, but like I said earlier, we need inflammation. It's important. I more like the herbs that help. So those NSAIDs are more COX chain inhibitors, which is an inflammatory chain in our body. We also have a LOX chain in our body, which that's the side that the herbs work on. So be careful not to be doing herbs, anti-inflammatory herbs, and NSAIDs at the same time, because we do not want to shut your inflammation channels down completely, because that's not good either for your health. But a lot of those other upper drugs that medical doctors give you, those are things that help just shut down your chains. But we don't want to do that, like I said, because it's not good. Because what happens is, it blocks the healing. I said there's importance, that inflammation is important. It blocks that healing. So then things don't heal. It prolongs the pain. And we do have research showing that when you take those things, it actually delays your healing process. And so you don't heal as fast. And then, then sometimes it doesn't control it completely. So a lot of times I've heard this best explanation is like you have these hot coals, and like that gets it down, or you have a fire and they just get it down to hot coals. Well, they don't get rid of that inflammation completely, and then something else aggravates it and it's a fire again, and you're just putting it down, but you're not completely resolving, coming to resolution. And that's what we want to do in the healing process. So you're stuck in this kind of chronic cycle of dependency. So then you take the medication again and get the coals down, but it never goes completely away. Just like I learned in Girl Scouts, you want to make sure you put those coals out completely, spread them around, stomp them out, water them down, and make sure that you're not going to cause a forest fire. So make sure you want to put that inflammation down completely. And we're going to talk about a couple ways to do that. So natural ways to treat. Now here in the office, obviously in the spine wise, we want to make sure the nervous system is able to communicate effectively. So, treating the spine, treating the nervous system, removing any joint misalignments, subluxations as we call them in chiropractic, because when those joints don't move properly, we're going to stir up that inflammation. So it's great when I realign the spine and get those joints right. It's amazing how quickly the body's inflammation goes down in those areas, but also the nervous system can communicate more effectively to make sure the right guys get to those areas to heal. So, and then also therapeutic massage is good. You can do lymphatic massage is good as well. And those are things that just help kind of get things moving in the body. Acupuncture is good, just kind of help reestablish communication with certain areas, maybe stimulate certain areas that need that stimulation. We also recommend physical therapy for just getting proper movement. So I've had several people that just maybe they've had repetitive movements. I have repetitive movements in my job, and there's been multiple times in my 21-year career that I've had shoulder issues. And it's so funny when I talk to my physical therapy friend, and she gives me a couple little tiny exercises to reverse the repetitive movements that I've done in my shoulder, and my pain goes away. So just little tiny things that we might be doing that aggravate our joints, physical therapy can really help reverse those. So anti-inflammatory diet and healthy healthy weight management. So anti-inflammatory diet is no sugar, no caffeine, or at least minimal caffeine. So trying to stay away from alcohol, the things that we know that inflame us. Also, it's increasing fiber. fiber is also one that's really good to make sure we're getting in, because that absorbs excess stuff that's collected. We have soluble and insoluble fibers. One helps absorb some of the extra stuff, and the other one helps feed our little probiotics, which I just talked about are really important for protecting our gut. So, just rich in our deep green leafies. We're going to talk a little bit more of that in a minute. But also, if you want to go back to my detox diet, we talk about all those things. And I did a little video on like the low carb Mediterranean diet too, if you want to watch that little brief video to get more detail on that. Supplements that I recommend often, the mainstay of most patients is healthy omega-3s, either a fish oil, a good healthy, pure fish oil, cold water fish that's rich in those omega-3s, but also flaxseed oil is also really beneficial. Eating walnuts is really good with your omega-3s. So those are things to try to get into your body, not once in a while. I just had a patient yesterday who goes, well, I eat fish once a week. Is that good enough? I'm like, no, unless you eat it every day, it's good enough. So, and even then, who knows how much you're getting depending on what kind of fish you're eating. So make sure you're getting at least 200 to 300 milligrams a day to really help your body be healthier. I talked about the fiber. So white willow bark is actually the ancestor of aspirin. So that's where aspirin originally came from. And that is a natural anti-inflammatory that really does help keep inflammation down. It is not the same as aspirin on over-the-counter shelves today. Just want to say that, because once we start refining things, we start to change how it affects our body. So that's a little bit gentler and doesn't have that craziness, irritation on the stomach, which is inflammatory in the new products. But if you want to look into that, curcumin, which is turmeric, so that's been very popular the last couple of years. We just know that turmeric's really good for inflammation, global inflammation in the body. That's just a herb that, just like I said, helps that LOX chain, kind of moderates that LOX chain. And then we have some green tea. So any of those antioxidants, also eating your bright colors, your berries, all those things help with those. But there's some things in green tea that are really good and beneficial, and antioxidants that help counteract inflammation. Magnesium is really important to calm the brain down, calm muscles down. So those are another thing that's really important to get into your diet, or also take supplementally. Pumpkin seeds right now, this time of year, pumpkin seeds are available. That's a really good one of the good ways to get some magnesium in. And then we get the some of your B vitamins. Vitamin C, as always, is always good. Again, make sure it's kind of a whole food. Try to get it into your diet that way. And vitamin D, especially in the wintertime months, it's very important to get, I say, at least 1,000 to possibly 5,000 IUs a day of vitamin D. So those are some recommendations that were helpful. So another way we just talked about, quit the nicotine. I know it's hard. There's bad habits are hard to break. I generally say try to switch it with a healthy habit. That's the best way to kind of switch off. There's so many programs out there you can look into. I've heard people doing acupuncture. I've heard people doing hypnosis. I've heard people doing meditation. But look into a program and see. Just try to find a time to just sit down and say, what can I do to better my life and better my health? It's got to be a commitment to yourself. And it will help you. It's worth your worthy investment to do that for yourself. So here also, like I talked about, eliminate sugar. And another thing I didn't talk about yet is a high fructose corn syrup. So that is another form. They say it's sugar, but it's manipulated. And they say that's the number one reason for non-alcoholic fatty liver disease these days is this high fructose corn syrup. It's really hard for that liver to process it. And so it's causing a lot of problems in the liver. So if you can eliminate that from your diet, and it's really hard, I'll admit, because you pick up anything processed, any canned things, they put it in almost everything. Unfortunately, I tried to get beets the other day and it was in like a jar of beets. I'm like, okay, well, I'm not getting beets then. So trying to eliminate that. And then alcohol, like I said, isn't inflammatory. So if you can eliminate that or minimize that. And then manage your stress. So we have different talks on that as well, other ways to deal with stress. I like gratitude attitude, try to just keep a positive mindset. And there's all these other ways to do that. And then get regular activity, exercise and movement. So do have a daily routine that you're doing. So this is, again, back to lifestyle. You are worth it. This time devoted to yourself is worth it, and it's worth your health, and it's worth your longevity and your quality of life. So, most people that come into the practice, they first come in pain and inflammation. I would love for everyone to come in and say, Dr. Rachel, I'm coming in just to stay healthy and well. And I'll be honest, I think I've had 3 people in 21 years that actually came in for that. And most of the time it was because they moved from somewhere else and they went to a different chiropractor before me. So pain is a great motivator to get people motivated to finally make changes in their life. And that's usually the first time they come in my office, they're in pain. And what the great thing about chiropractic and what I do is we can get people out of pain pretty easily. We have a lot of data and a lot of research that we do that. Can't guarantee that, but most people that come in the door, we can help. And that's what's great about what I do. So it's great, but it's like come in pain. And it's great that I've had a lot of people that maybe are taking Advil every day or several times a week. And I'm just thinking of one story, someone that came in earlier this week, and she started last year with chronic knee pain, and she was doing the Advil every day. And just within a couple months, she was no longer doing Advil. She felt better overall. She made some supplement changes, dietary changes, all these things, lost some weight. She's feeling like $1 million, and she feels better now than she did several years ago. And so it's amazing just doing some tweaks, getting her adjusted, getting her aligned, treating all these things, how much better she is feeling. And I just attribute to the body. The body's amazing. I just work with the body. I restore it, adjustment wise to where it needs to be, correct the subluxations, take interference off the nervous system, give them recommendations of what they can do, tell them what to eliminate from their lifestyle, what they add to their lifestyle. And it's just amazing because they do the work. I do a little bit of the work. So I just correct subluxations. And then the main diet that I said before is that low carb Mediterranean diet. So like I said, you can watch another video on that if you want some more information on, or Google that. And then I said per person, we can try to recommend some supplements that would assist them on just their body healing overall. So if you have any other questions, you can always contact us through the website, thedoctorinyu.com. If you want more information, I did write a book, A Journey to Vibrant Health, that is on Amazon. That's kind of a overall health recommendation book. And I do have lots of my videos that we moved to my YouTube channel, which is Dr. Rachel DCCACCP, which is my pediatric and pregnancy certification. So I appreciate you joining me today.